how many of you know there's a biotechnology has color codes for every department? There are 10 different color codes. I'm not sure how many of you are aware of this. So basically, this is just to say, because I also give talk to many universities, and many of them are not even aware, like there are color codes for biotechnology, and this is like universal color codes for everyone. Like in agriculture means green, pharma, bio means it's red, like a ocean, like a blue means for oceanography. So anytime when you talk about biotechnology, it covers like all the departments of the 10 departments, 10 different fields, which covers biotechnology. So the same thing which Dr. Arti mentioned, so I'm going to skip this. In total, like out of the several $1 trillion business, India is only covering up to $100 billion. And we are like, we are contributing only around less than 3% contribution. Same thing, like she mentioned, all this one. So in terms of career prospects also, she has covered many of these aspects of it. So what we do at Affigenix is basically, I have a unit in Bangalore which is more than 12 years old, which basically we provide contract services for a company like Levim. So we develop customized assays, and for some companies when they manufacture insulins, every batch they manufacture, they have to test the quality, and we do quality testing for them. How much of impurity is there, how much of biological bioburden is there, those kind of testing we do. And we also customize and develop kits for doing the clinical trials, animal studies, those things. Then I have a unit in Chennai, which is we started during COVID times. We came up with the RT-PCR kit for COVID. That's our first product. And now we are on 42 products, which is mostly used in diagnostic IVD industries. So these are the various services. Basically, we do immunoassays and PCR-based assays. Basically, it's a proteomics and genomics aspects. And I don't go into sequencing, but just only PCR and those kind of work, and ELISA-based assays. And in terms of expertise, as I mentioned, it's like more of a bio-related wise. We do all the biochemistry, molecular biology, cell biology also we do cover, and mostly immunoassays and PCR-based assays. Okay, I'm going to go into the thing. So how many of you know the difference between a pharma and a biotech company? What's the difference between pharma and biotech? Or what is biopharma? Okay, see, pharma is like anything to do with chemical, like tablets which you use, like they are come under pharma. Anything come from a life forms like insulins, monoclonal antibodies, like a cell-based therapies, those come under biotech. And what is biopharma? These companies will do both bio as well as, like Biocon is a biopharma company. They do small molecules, which is a thing, and biologics. And for a take-home message, just to keep in mind that small molecule products are like it's a low value, high volume business. And biologics, it's like a monoclonal antibodies. It's a high value product, and it's like a very low volume product. Okay, so in terms of career-wise and everything, the whole thing is going to apply, which I will talk about it later. So besides, there are a lot of differences in terms of it's a small chemical versus a biological product, in terms of manufacturing, quality checking, since you are all a biotech students, career-wise, is like, preferably you would like to want to go into biotech thing. Even in pharma, there are biotech jobs are required because microbial testings and all those things, only biotech students generally they do those work. She already covered this one, like as you mentioned, these are like each of the molecule which gets patented and sold in the US, the patent is for a period of 20 years, and some of the drugs is for $4 to $5 billion a year. It's a huge business. In India, like monoclonal antibodies are very expensive, and many patients can't afford, like many people can't afford to take it, and that's why the market is not picking up in India. The biggest successful story in India is the insulins. Because the diabetic capital of the world is India. I don't know how many, almost 80 million people are diabetic, of which only 5% of the 80 million take insulins. So insulin is, in biological terms, it's a low volume, high volume, low value product in biologics. Whereas monoclonal antibodies, say for example, a company like Biocon, they make 100 batches of insulin per year. Whereas monoclonal antibodies, they may make only 2 batches, because it's not a big volume business. So if you take, I think in the morning you heard about the pharmacovigilance. So in a drug discovery phase, like typically from the scratch from a novel drug discovery, it takes like from zero today if you started, almost it takes 10 to 15 years to come to market because it has to go through various stages of discovery, development, animal studies, efficacy studies, then you have to do clinical trials, then regulatory approval, and then going to market, then post-marketing surveillance is what the pharmacovigilance covers. So, whereas in India, if you look at it, like in India, we are not very good in making novel drugs, okay? Especially in biotech or in pharma space. We are basically, India is very good in making copycat drugs. In pharma, it's called the generics. Once the patent expires, we start making. So what do we call this as a patent cliff? So every patent covers for maximum 20 years of covers. So around when the patent is going to, we call it a cliff is around 18 years or old. Patent is going to expire in another 2 years. All the Indian companies, this is a big blockbuster drug, is going to sell. So everybody started copying that one. And as soon as the patent expires, they all launched the product. Biologics takes around 5 years if you want to do a copycat drug. Whereas in the small molecules, it's 2 to 3 years they copy and just come in because it's a chemical, is they do it very good in reverse engineering and doing it. Okay. So where are the opportunities if you were to go into biopharma company like Biocon? There are various departments which I already mentioned, but I always want to say like when you come for an interview and like especially if you're a fresher, which I see when they come, they apply and the HR department will give the CV to say, for example, it comes to my department, which is I used to do the biological department. I don't do any genetic any cloning or cell-based work there. The students will come say, they will say, I want to do only cloning cell. Okay? So no, you came to the wrong department, immediately we'll send you off like thing. And HR will give you opportunity for one you have to face one interview. Because you can't go to every department interview because you're not qualified for that one. Because there are thousands of people applying every day and only few gets interviewed. And what I always say is, get into the company and then you try to move up the ladder, gradually learn and grow. Don't be, maybe you may interest maybe to do cell biology, okay? But you may not get an opportunity to get into cell biology because the HR didn't assign you to the department, especially if you're a fresher. Okay? Say for example, one of the reasons I put this bar is, like if you take molecular biology, the amount of cloning work, those things are very, very limited in big biopharma. Because all the drugs which is already expressing in cell lines, commercially sold, basically big companies will buy from them because already the high expressing cell, all they do is the upstream, downstream, and become a drug substance, make as a drug product and they sell it. And where the jobs are, most of the jobs are like, where you see the long horizontal bars, that's where the most of the jobs are. And especially if you get an opportunity to get into interview with those things, and you do well or they're willing to train you, please take it. Because after that, at least sometimes what happens is we call this a silo. In big companies, they won't let you move from, say you enter the QC department, they won't let you move from one department to the other. Because then everyone will ask, I want to move to that department, this department. Some companies won't let you do it. But say you work in Biocon, then when you go outside, you have plenty of opportunities after a couple of years of experience, gaining experience there. Okay. So just to give you a highlight, like these are the various things. Various departments exist within the thing. And in terms of like a thing is, one other thing which HOD was asking, like, what are the career prospects, how do you do it? Say if you enter as an undergrad student and you don't have a master's, there is something called a ceiling. You can't go beyond that. And likewise masters, and then masters if you are an MSc or an MTech. So there are hierarchy. I think in India it's like not like in the US. It's like a merit based. You are targeted. You don't have to have a PhD. You can become CEO of a company there. But in India, like you to head a department, you have to have a PhD. Otherwise, none of the PhD won't work under you. If you are a master's and PhD, don't want to work with you. So the HR also have to balance that way. So what they do is like either you move out or you find out something else. That's the way it happens. But either you want to get a PhD, you want to become a group leader or group thing. You want to do it, you have to be extremely talented. and like you are become like an indispensable. Okay, this guy is required, and only without a degree you can do it. Degree is very common in India. I think in India we are also very conscious about the designation of you get, whether you are president or vice president of a department or those things. So that's you can't avoid it. And although we don't like Hindi, but irrespective of it, especially if you are in Bangalore, many of the board meetings or many of the group meetings is spoken in Hindi. Okay? And in English is a spoken language, but along the way the conversation, like you have to learn Hindi also along the way, because at least you have to be able to understand what they're talking about. And you can't change that, because we'll say you can reply in English, but that's the way it is. So you have to adapt, and suppose you have to manage many Hindi guests because they will all speak in Hindi. Like it's like if you say Bangalore, it's like more people of Tamil and North Indians are there than Kannadigas. Okay, so Kannadigas minority in Bangalore, typically in many areas, especially in work environment. So it's like you have to if you want to become that one, you have to force to learn that language. You can't say I won't learn Hindi. Then you are not going to go ahead and think. Anyway, I don't know Hindi either, but. This is just to show you an IBD market synopsis. Some of them, like I was asked to talk about, about career opportunity, not only job-wise thing, and also about being an entrepreneur. What is that thing? Coimbatore is considered as the mecca of education, kind of like all the education departments are here, very highly qualified people, and the entrepreneurial, it's known for the entrepreneurial thing from Tirupur and stuff. What I suggest is like, if you want to be an entrepreneur, what is that? What should I start with? Some of them will come and ask me, what should I start with? How do I do it? There are a lot of courses available, like MSME training centers are there, what you have to do legally, what you have to do. And being an entrepreneur is not going to be an easy job, because you have to be dedicated, because you have to put your own money, time and effort on that one. So you have to do a lot of hard work. And sometimes it pays off, sometimes you're going to fail. And that's you have to do it anyway. And what I would do is don't spend your parents' money. There are funding available from the government. Anywhere between 10 to 20 lakhs is given. If you want to try something, you can write a proposal and you can try to get the funding and you can start that person to it. Okay. And anything you make in an entrepreneurial thing, it's one of the hard lesson which I've been learning and I've learned so far is we can make very good products, but it is very difficult to sell it, because it's very competitive, it's very price competitive. In India, it's very price very competitive. So selling a product is not that easy. Okay, so for example, like if you take everybody eats 3 dishes, 3 food meals a day, right? That means anything you make, you should be able to sell it. You must have seen, I don't know, here in Chennai, so many biryani shops are open every month. Okay, they close after a month or 3. Either because of price pressure or quality issues or something, they are not able to do it. And that means if you want to start a hotel, means you have to be consistent, quality. You can't fail even once. That means you're doomed. So you have to gain experience somewhere before you start that kind of risky business. And as a student or a thing, how do you want to do it? What I'm saying is now the social media impact is so huge. One thing I've been told, I gave a talk in Bangalore, and kind of many students picked it up, and now they are doing a very good business. That's what I was told by HOD from there. So what I told them is, so you want to start a business, and how do I know how to sell it? Do I know how to market my product? Okay, selling is different, marketing is different. Marketing is like how you advertise, how it reaches many people, and then how do you get an order, how do you close the deal, kind of thing. Okay? So I told them to see Bangalore is in and around Bangalore, there are a lot of horticulture products. Okay? Many food, like fruits, vegetables, plants, nurseries are there. So I just gave an example to them. If you go and check a plant called a desert rose, I don't know whether it's called adenium. I don't know if this plant called adenium. You can check that on adenium or a desert rose. Okay? You open, there are so many Facebook pages. You can sell seeds, you can sell saplings. You don't have to manufacture. Okay, you find a nursery, say TNA Botanical Nursery, you go see, and you you take a nice picture, put it in Facebook, and say it's like 30 rupees. Many people are willing to buy 30 rupees plus shipping charge. The 30 rupees you sell it for 60 rupees plus shipping charge. Okay? It's a very good business. So you just start with, as a hobby or something, you start and see whether I can sell this product. Okay? So I don't know whether you've seen that, like when you go, these porcelain pots and all, they sell it on the roadside. Have you seen this one? Okay? I know one guy in Chennai, he doesn't anything big. He takes nice pictures, displays of those pictures, he puts it on Facebook or Instagram, he gets orders. This guy, he bargains it for like 800 rupees and he sells it for 1,600 rupees. Because he has the technology and he knows how to reach out media, and people are willing to pay for it because it's available on the roadside. And that day, because he's a poor guy who made all the hard work and he did the work, but he's not doing it. What I'm saying is, you just want to see, your work, or do I have the skill necessary, or I'm going to gain some experience, I want to gain some experience. Try these things, which is less risky. If you only when you get an order, you're going to buy from him and going to ship it out. Okay, so that's the thing. Just that's for an entrepreneurial journey. Just start with that one, gain some experience, and gradually you go on that way. Okay, in diagnostics, so one of the things which I want to point out is, so do you know any business where you pay money in the morning before you even get the service and you don't get the results for maybe a day or 2 hours later? Okay. The only business is, even in stock market, like, you have to pay commission and all those things. In diagnostic industry, it's a big business. If you any diagnostic labs you go, you have to give the blood and the money or urine sample or anything upfront in the morning. You may get the data, even X-ray, everything you have to pay upfront. That's the only business where you pay everything in advance and then to get the results. Any other business, you won't get that money. You have to get the service done, after you get 30 days credit to pay. Between Bangalore and Chennai, I tell you, Chennai business is 100% cash and carry business. Only if you get the money, check, I ship my material out. Okay. Whereas in Bangalore, I provide services, big companies, you won't pay me for a period of 3 to 6 months. Okay. So that's why I just want to move from Biopharma into diagnostics. Okay. So diagnostics is such a good business because now India is very health conscious. If you want to be an entrepreneur, like I tell you, you go to any diagnostic lab, have the high-end labs, like very diagnostic lab, if you go, the lab technicians are not +2 or 10 standard. Okay. So I tell them, if you guys are biochemistry, biotechnology, you know how to do pipetting calculations, you can gain experience. What I'm saying is, if you want to do an internship for a month or 3, because many students come and ask me for an internship when I'm doing second year, I want for 1 month internship. The 1 month, even the boss of the company want to give you an internship, but your team, the employees there, they don't want to train you because they know 1 month later you have to go. Only if you're going to be there, they train you because they can give some of the work to them for you can do it. So internship for 1 month, 1.5 months, don't look for Biocon or any company in biotechnology. My suggestion is, if you want an internship, go to a dairy industry or a bakery or a diagnostic labs. Okay? And you say, I don't want any money, this summer, 1.5 months, I will work in your lab. And you just, daily you will get samples from morning 7 o'clock till 2 o'clock, all the work gets done, the reports is prepared in the afternoon. So how do they process the samples, how do they do it? So if you like it, what I suggest is, you don't have to start your own diagnostic. There are franchises you can get it, like Medall, like Lister, Metropolis, those things, you can get the franchise. Okay? That's the less risky because you get patients automatically and you do the analysis you can get. So you gain some experience, then you start your own brand, you start your own diagnostics. And diagnostics, in my opinion, since you have done it, all you need is some bit of experience and expertise. So one of the things which I have told them is like, you can have a curriculum because the diagnostic industry, especially after COVID, is going to boom like anything. How many of you know about a company called Thyrocare? It's a Coimbatore-based company. Okay? Coimbatore, the person, Dr. Velu, who started, is actually a Coimbatore person. He's one of the success stories. Like, he sold his company during COVID times for 4,000 crores. personally made a 4,000 crore profit. Okay. It's like I strongly recommend you guys watch. He's like a now is like his speeches are very inspiring. You can look in YouTube. Dr. Velu Thyroid, like if you look at a very knowledgeable guy. He speaks very good. And he also invests in companies, startup companies, and he does it. So if you want to start up, go on entrepreneurial journey, yes, that's good. So if you take in diagnostics and manufacturing unit, these are the thing which I typically keep advertising in LinkedIn. If you want, you can see it. So the other one I want to point out is like when he approach me, especially after a presentation like this, when he will approach me, I want to do an internship. Right. So like to start your, how do I identify a problem to find a solution for it? This is some of the things which my basic undergraduate degree is agriculture, and I'm trying to solve problems for many of the farmers. And one other thing is cold chain shipment. Many of the produce which they make, they become stale very soon, especially like grapes and strawberries and those things. You make flowers, it's very good only for a day or two. Right? So one of the things is how do I preserve it, what do I do for it? If you find a solution for those kind of things. Some of the problems which many people are trying to find a solution for this. So if this can ignite your mind and you can come with a solution for any of these things, it will be good. You will have a huge market for it. So the other way to find out, okay, what should I make, or how do I know what should I make? What is that? There is a demand for it. There are websites which you can go see what is the products which are importing into India. Okay. So, for example, especially after COVID, now this Atmanirbhar thing which is started by the US government and the current government, which is Make in India product. Okay. Previously, we can import anything from China, Korea, and everything. We can finish product, we can sell it here. Now, only raw materials are allowed to be imported, not the finished goods we cannot import it. So there are a lot of restrictions in order to promote Indian companies. For example, in bioindustry, why it is not growing like an IT industry? That's what everybody questions. Okay? So in terms of IT industry, it works 24 hours a day, like 364 days, 7 days a week. Work gets taken home and work from home because the hardware which is required for IT industry is only a laptop or a desktop or a printer. Whereas in biotech or any biologics, you require a huge amount of capex investment. And it is not used for 24 hours. Okay? It's always, there's no shift, only in the manufacturing you have shifts of 2 shifts or 3 shifts. Okay? The rest of the analytical department, any other department which we talk about, it works from 9 to 5, Saturdays, Sundays, or holiday. It means several crores worth of equipment is not being used 24 hours a day. Whereas in IT industry, flourishing is because of capex is less, and no need of regulation, any data, transfer over internet. Whereas even if you make one small product, shipping charges is huge in India. Okay? The logistics cost is very high, and that's why it's not flourishing as the way IT industry flourished. And if you're good in computers, in the IT industry, like you can go for this bioinformatics and all those things. In diagnostics, the next generation sequencing, molecular diagnostics. Right now after COVID, RT-PCR thing is very popular now. But one other thing is especially all the other things is very difficult for somebody to duplicate it. In RT-PCR thing is like once you amplify the gene, people know which gene you are amplifying. It's very difficult to. They don't make their own primers. Some big labs and all, they make their own thing. They start using it their own. This is called research use only products. You don't have to go to regulatory purpose. It's kind of that's why like COVID, not all the dengue, chikungunya didn't take off very well. So as a student, as an MTech student, who come to me also for an internship or anything, or ask for ideas also, I tell them, you can, just for example, in every biochemistry reagents which we use, imported. Okay? Every diagnostic products, antigen, antibodies are all imported in India. Okay? If you have a department here, Why since I basically I put it in LinkedIn also, telling there are a lot of enzymes which we import. Okay, if you have a very good department and you have protein biology department, you have fermentation, things required. Enzymes are very tricky because you have to have the maintain the enzyme activity also. But a lot of, for example, dengue, one of the antigen which we monitor or directed line is the NS1. Okay, and I can guide you what to do, how to do it. We can help you with the assays, monitoring the purity, everything, and you make it, and we fix the price. We are willing to buy also. You will not only sell it to me, you will sell it to many companies in India. Okay, and you can export also. Okay, if you look, these Chinese companies like they, for example, there's one company called Biologics. I don't know, you can note it down. SINO, Biologics. You go see anything vector is ready with what tags you want, everything is ready, and it's not cost much, like 15,000 to 20,000 rupees. Say you want to do a master's program, just I'm telling, you identify an antigen, which is you read it in literature or something. You buy the stone, express it in the fermentation wise. You must have a microbiology lab. Grow it, express it, and downstream purification. Very simple purification technique. If you have a tag, it's only one affinity purification. Then you do a gel, grow it after. I tell you, you finish this one and you have a product. You can have a publication, or you can have what you call which is very good. You can go for a filing for a patent also. And in India, if you're a startup or you're an individual, you can get a patent in 6 months, which is not possible anywhere in the world. Like it takes minimum 3 years to get a patent. Okay, and with that one, you do a project and you have come up with the product. You will have a satisfaction, and also you will learn all the techniques which is required for a biopharma industry. Okay, because one of the things I always say, have you, like for example, if you are a student 4th year and everybody is applying, I don't know what rank you got, what do you think, we don't even go by marks. So I always look for in your CV, a lot of people say, I know Bharatanatyam, I know Karate, that's the only thing difference. And everybody attended the same workshops, everybody attended the same training, same classes. I don't know, how do I make the difference of you? 40 applicants come from you. As soon as I say I'm willing to take internship, 40 CVs will come to you. I'll always tell the HOD, please narrow down 4 or 5. How he is going to select, I don't know. But the 4 or 5, among the 4, I can take only one. And if you're I don't want to call you for an interview, I want to take one of you. Either I do a phone interview or something, or I look for a talent. Okay, among the 4, has anyone worked in any laboratory? It can be a diagnostic lab or in a bakery or something, where fermentation or anything. Okay. If you show me something, then okay, I will take you. That's the way. Okay. How do you distinguish yourself from the others in your CV itself? Like, so that whether you can start from first year or second year. One example I can do, last year 2 students from Manipal came. Actually, it happened to be one of my friend's daughter and another friend from Bangalore. They came in with the work. So because when they came, HOD of Manipal, their department, they said, and I proposed, my proposal was, we were doing a project for a cancer institute, Radial Cancer Institute, which is basically, I don't want to go into detail because it's not mentioned. So it's for oral cancer. Okay. So idea was like the problem they came to us was, we know what biomarker is there, which is overexpressed if you have an oral cancer, and in the field they want to go screen it. It is very difficult because many of them chew tobaccos and things like that, and their mouth is already, either red color or something. It's very difficult for us to distinguish. But this biomarker is highly expressed. Can you find a solution for us? So what we propose is something they have to gargle in the mouth. Okay? We said, okay, you can inject the biomarker into chicken, and chicken will produce the IgY, which is basically an antibody called IgY, which is will always the yellow of the yolk. Okay, and you can either purify it and you make a like a mouthwash kind of solution. We can gargle it and you can have a fluorescent tag to it, and so wherever it's the antigen is there, it will you shine a UV light or something, it will glow. So that's the idea, and we gave that idea. Radial Cancer Institute proposed it, and they got the grant, and we are doing that one. So but having proposed, but we don't know how to purify the antibody from IgY, we saw the literature. And these students came and we said, okay, we give you this project, you have to purify the chicken IgY from chicken egg. It's a very tedious procedure actually, compared to any other IgY purification from rabbit. So he said, okay, what do we so when you gave the proposal, this is what you'll be doing for 1.5 months or 2 months, you're going to work with us. 3 months they stayed with us, 3 months you're going to work. If you're willing to do this one, we are giving the project. They told the HOD, they said, oh, purifying where you go, it's not a big deal. I told them, you learn this one, you know how to do protein estimation, you know 1D gel, Western blot, all those things you're going to learn. And surprisingly, those 2 girls are very dedicated. They did the work. One girl purified IgY from the yolk, and we wanted to make a molecular weight markers for protein. Right? Any Western blot or 2D or 1D gel we run, we keep buying molecular weight markers. He said, okay, why don't we use the students to make some molecular weight markers? You must have read everything. Right? If you take an IgG, it's 150 kilodalton is intact. If you reduce them, it will become 25 and 50 kilodalton. Okay? So likewise, IgY is 170 kilodalton. So you get 35 and 70. Okay? So in one shot, we got 3 antibodies, 3 markers. Okay? Reduced and non-reduced. And then she purified like IgY we got. Then we got ovaglobin, ovatransferrin, different proteins we thought about to purify. And they went and showed this data to the faculty, and the faculty got very excited. They said, we will write a paper. And they had already written a paper on that one. Okay? I don't know whether it will get accepted, published, or I don't know what kind of journal, but I can guarantee you those 2 students, anywhere they apply, they will get a job, and their intention is to go abroad. And earlier, who worked with us previously, we went on with John Hopkins, and the John Hopkins girl's story I'll tell you, that's also very good. 2 girls went, 1 girl went to John Hopkins, 1 girl went to University of College. And all they did is a summer internship, 2 to 3 months, and a very simple project. Okay? 1 girl is actually a high school girl. Okay? And before COVID, she was working, and then COVID came, she was not allowed to come into the lab because she was a high school student. So what are the project we said? I told her, why don't you work from home, why don't you do this project? So this thing what I suggested was, this girl is like wondering, whenever she comes to lab, she colors her hair, different colors every week, and she goes for a weekend party, it's a different color. So we used to tease her. He said, okay, you use a lot of chemicals for it, why don't we use a vegetable dye, why don't we make it? And then she asked me how do we make it, then we asked her to do the literature search. So, with the beetroot, kumu, like manjal, like any food coloring thing material, right? Fermentation she mixed. She cut her own hair. During COVID, she can't go out of the house. Cut her own hair, stain it, put it overnight soaking, next day she wash it. She has to monitor how many days work. And I haven't even seen the results of any of this. Whatever she wrote as an essay to the university where she applied. Okay? They said this is very creative what she did, because using vegetable dyes and things. She also sent me a video telling how do you, from coconut shell, how do you make the maridani? I don't know whether you've seen this video. How do you make the maridani color? Very easy to make it. So you add it instantly, it stains like a maridani. She found that in the Google search, and she found it. She wrote all those things as a story, and she got in the US, like to get admission, how many marks, social work, and what is your essay, how do you read, how do you demonstrate that you are very creative or very innovative. That's what they do. They did that, she wrote that one, she got it. So I was asked to cover this aspect also, because if many of you want to go abroad, you have to demonstrate, you want to get admission, especially with a scholarship or anything, you demonstrate that you are creative, you are innovative, you can come with a product with very short period of time. Everything is there, you can search for passion. Last but not least, I think I want to take much time. One of the things I want to say is, now how many of you know about ChatGPT? Okay, you ask any questions. Okay, say for example, I always used to struggle we used to import all this when you do Western blot or ELISA, we used to block us, right? Some of them are super blockers, we call it super blockers. Like it gives a very low background, very nice picture. You don't know what it is, like we are trying to simple for patent and everything. So we went and searched ChatGPT, what would be the recipe for what used in that one. Okay. And anything you can find out now, you put it within seconds, you get all the answers for it. So if you want to be creative, you have something, how do I do it, how do I maintain it? There are some solutions there. All you have to do is do this experiment and prove, yes, it works. Okay. So I just saw on video, I just want to give us an example. When you have this banana, the bunch, the thing, right? How do you make it ripen? So one camera guy mentioned. So he just cuts the stem of it and he puts some garlic. Okay? And with that garlic, he says it will ripen very fast. No chemicals, only the garlic thing will ripen. And I don't know if that is true or not, but I want to try it out. Because if you can make a garlic and ripen a banana very quickly compared to without using any chemicals, I think that's a good thing. That's I saw the video, then I went and checked it. ChatGPT does it do. Some say no, it's like not really true. But there are some properties of garlic. That means you have to find out, maybe I have to use the juice or I have to make a smoke out of it, which may ripen. But that's an experiment which you can do it. So I'm saying there are a lot of things you see on Facebook, WhatsApp, you think, right? If you become very curious, can it be applied? And one last recommendation is, anywhere you go to PhD or anything, please do an applied research. You have to come with the product at the end of the research. Because if you do classical genetics, like say for example, olden days you can do all those classical genetics like Drosophila and all those basic things, it's very difficult to get into industry. Especially if you are a PhD. Because there is an inhibition to hire PhDs unless you have experience or you have postdoc experience in a different field. If you did not do any applied research. So any projects you do, just make sure you come with a product, whether it's a 1-month project or a 6-month project, try to come up with some product which will impress, and either you can publish it or you can patent it or you can sell that product as well. Okay. With that, I just remove